High childcare costs are impacting families across the country, including here in northeastern and central Pennsylvania.
Throughout our area, Lackawanna County has the most expensive childcare prices, with parents paying an average of $12,000 per child every year.
In this special report, Newswatch 16's Amanda Eustace spoke with parents and people who run daycare facilities, all struggling to stay afloat.
We have happy,
hearts,
gentle,
hands,
listening,
ears,
and kind words.
That's the mantra inside the Martin home in Troop. Hannah Martin is a stay-at-home mother of two. She spends her days with her sons Lewis and Ramsey.
We eat, sleep, and breathe this playroom.
Before the boys were born, Martin was managing a personal fitness studio and working as a nurse. But high daycare prices forced her to stay home with the boys.
So when you add up, what you pay someone versus what you're making, it's like, is it even worth it? Is it even worth it to go back to work?
Her situation isn't just contained to these four walls. In the house just next door, it's a similar struggle for this mother of three, Raquel Cruz. Her youngest child, August, is in daycare full time. For her, daycare is about socialization, but
right now it's basically a second mortgage. It's just around the same exact price.
It costs her $200 per week, which according to the U.S. Department of Labor is less than the average price per month at an infant-based center in Lackawanna County. Throughout northeastern and central Pennsylvania, Lackawanna County has the most expensive child care prices, with parents paying an average of $12,000 per child every year. That's why Cruz has had to put her passion for art on hold to take care of her children. She hustles daily to make extra money.
I do Instacart deliveries, I do Uber Eats deliveries, I help my parents with their business sometimes, I face paint, I try to do commission works for paintings.
It's not only hard for parents, but for child care centers like TriStar Academy in German too.
Child care is in a crisis nationwide. It is not just northeastern Pennsylvania.
As the owner of this facility and three others, Kathleen Parrish made it through the COVID-19 shutdown, reopening of her centers, and the struggles brought on after the pandemic. Federal emergency COVID relief funds did provide $39 billion to support child care centers and parents, some of which TriStar received at the beginning of the pandemic. However, those benefits expired in September. Governor Shapiro's administration says the Department of Human Services also invested significant funds during the pandemic to address child care workforce shortages and provider stability. But regardless of the help, Parrish says it hasn't been enough.
It was a Band-Aid. The further we got away from COVID, the more the need for child care increased. So we pushed that issue down the road so that it was exacerbated when at the worst time, when our wait lists were getting longer, when the staff said, I'm not coming back.
Parrish is still dealing with staffing issues. Currently, she has about 12 teacher openings across her centers.
When they get to that realization and they find out, I can go work at McDonald's, Sheetz, wherever, they can go work somewhere else and make a lot more money doing it. That's what they're doing.
Parrish can only afford to pay her staff around $11 to $16 an hour, depending on the role. That falls in between the national average a child care worker makes at just $13.22 an hour, according to the Department of Labor. In April, Parrish hosted a roundtable with other child care centers and lawmakers to bring attention to the problem. Months later, she says nothing has been done to help ease the burden on centers and families.
We're losing out on quality staff because we can't pay them what they're worth. We can't pay them what they're worth because the money comes from parents, and those families are tapped out.
Another mother, Alexis McGee, knows what it's like to be tapped out. She did receive some help from the state's Child Care Works program, which helps low-income working families pay their child care fees. But it didn't last long. Once she got a job and made more than the threshold allowed, she didn't qualify anymore. Struggling with waitlist after waitlist, she opened up Little Sprouts Academy herself in Archbald.
I'm dancing a very, very fine line of productive, business in the green, and also like paying people a living wage and helping parents anywhere I can.
But it isn't easy to get subsidized childcare services in the state. A family of four needs to make less than $60,000 a year to qualify. Earlier this year, the Shapiro administration increased base rates for childcare providers that participate in the Child Care Works program. But for those working middle-class families who don't qualify, it doesn't matter. These parents say more needs to be done.
I think it's the cost of living just does not match up at all with the expenses of everything for everyday life. And I also think it's super important that childcare be tackled first because it allows families to work, and that helps with a lot of economic issues going on.
It's time people start putting children first. That's where the issue lies. Everyone agrees, yeah, there's a problem. Let's fix it. But when it comes time to walk the walk, that doesn't happen.
Many other countries offer all parents some type of subsidized childcare for young children, but the United States does not. As for the state of Pennsylvania, there isn't any solution currently in the works to further help families and childcare centers. With photojournalist Dan Taransky, Amanda Eustace, Newswatch 16.